Hi, Dr. Milkie back with another foot message for you, some foot information. So I'm going to talk about the ball of the foot. And people will come in and say, I'm having some pain on the ball of the foot. And I would say that this is one of the more complicated areas to get a diagnosis for, as well as get a remedy for. We put so much pressure on the balls of our feet when we walk. Obviously every step we take, we're pushing off from the ball of the foot. And there's just a lot of things that can go wrong. So the blue area, there's some tendons down here. The yellow, there's some nerves. The red are some muscles. What we don't see are the bones. And of course, we've got a lot of bones down there as well. So a lot can go wrong. And underneath that, and before we get to the bone, there's ligaments down there. There's something called a plate. It's called the plantar plate, which is a thick area down there that, someone will come in and say, I feel like I'm walking on something, a marble, a ball, my sock is bunched up. And it could be that there's some inflammation of one of these plates, the plantar plate, we call it. So that's a thickness, and usually it's the second metatarsal where that happens. So there's a lot that can go on down there. And, you could have a problem on the top of the foot and it can cause pain on the bottom of the foot. So that even gets more complicated. You could have a nerve that's pinched on the inside of the ankle over here, what we call the tarsal tunnel, and that can cause pain on the ball of the foot. So, we're up against a lot here when it comes to the ball of the foot. We take an x-ray, we see if there's any bone issue. And these bones are, there's, somewhat of a sharpness to that. So one of those bones could be just a little bit lower than another one, and we could put more pressure on that, and that can cause pain. We could have what's called a stress fracture on the top of the foot, and that can cause pain on the bottom of the foot. So again, there's a lot going on the bottom of the foot. And, we have to be good detectives as podiatrists to figure out what we believe is going wrong, and then, recommend a treatment plan for it. And of course, we want to do everything we can to keep you active and obviously keep you from having a surgical procedure or having to be put into a boot or, really cutting back your activity level, which can be challenging because, again, we put so much darn pressure on the ball of the foot. The one thing I would tell you for sure is to have something on your feet when you're in the home. I have that happen so often with mostly female patients, but men too, who are wearing, socks or nothing on their feet in the home because they just grew up being barefoot, and I totally get it. But, spoiler alert, as we get older and typically 40 and over, I'm totally in that age group, we need more cushions. So a good pair of sandals like Ufos or Birkenstock or Vionic or Keen or Chaco or, those brands, or a good pair of athletic shoes such as Brooks or New Balance or Asics or Saucony or Hoka or what have you. Again, that can go a long way towards not feeling that discomfort on the ball of the foot. But oftentimes there's other things that we need to do. Again, number one, we need to find out the diagnosis. And then once we know that, then we can recommend a treatment plan that hopefully can get rid of your pain quickly. So pain in the ball of the foot, super common. Now that might not be you, that could be a family member, friend, coworker, what have you, but this information can be valuable to a lot of people. So feel free to pass this on. And as always, thank you for watching.